Good afternoon and welcome to Florida Hospital's Healthy 100 Live Expert Web Chat. I'm Jennifer Roberts, and once a month here at Florida Hospital we pick a topic and we bring in a Florida Hospital expert to get some of your health questions answered. We have our conversations for no more than about 30 minutes over the lunch hour, so you can get some health information you're interested in while you take a little bit of a break from work. Now, today's topic is going to be sports concussions, and we have an expert already in the house today, Dr. Anthony Legalbo. He's a neuropsychologist with Florida Hospital's Sports Concussion Program. Welcome. Thank you so much for joining us.
Thank you for having me.
Great. And I have a few questions to get things started off with Dr. Legalbo, but what we really would like to do is have this be a forum for people that are watching to get their questions answered. So we would love for you to participate in our chat. Type in your questions. You can use the chat forum on the right-hand side or the bottom portion of your screen to take part in the chat. So Dr. Legalbo's here. We're ready to go. Let's get things started with a few questions to kick things off. So sports concussions. We hear a lot about concussions with NFL players. There's a lot of buzz on that on the national scene, even on the college scene, sports scene as well. But here in a local community, there are other groups that are at risk, namely high school students. Talk to me a little bit about what the dangers are for high school students and concussions.
True, yes. Most of the kids that we see in our concussion clinic are high school age students participating in a variety of athletics. A lot of them are football, but we do see a lot of other sports as well. Soccer, volleyball, cheerleading, not just males either. We see a lot of females too. And one of the biggest risks, I think, in this population is that a lot of these kids obviously are still in school while they're having this injury, and it can affect their performance academically. One of the things we try to do is reduce the impact of their concussion and the symptoms they're having on how they're doing in school.
A lot of people might jump to the conclusion that when they hear about a concussion with an NFL player, it's worse for someone who is older to get a concussion, or maybe the hit is harder, or maybe it's more impactful. But actually, my understanding is the opposite might be true, that it's really more harmful on a younger brain to have a concussion. Talk a little bit about that.
It can be more harmful in a sense, maybe a couple of ways actually. It turns out that younger athletes tend to recover longer. It takes longer for them to recover from a concussion compared to older athletes, which was not initially thought to be the case. Initially, a lot of people thought that because the brain was still developing, it was more plastic and it could adapt to the injury a little bit faster perhaps than an adult, but it does not seem like that is true. The other thing is that younger athletes seem to be at greater risk of having a more severe outcome if they have two injuries back to back. So if someone has an injury and then they get hit again before they have fully recovered, there's a greater risk of having a more catastrophic outcome. There's been a few cases where kids have died and several cases where kids have had some kind of permanent brain damage that's affected them for the rest of their life. And that is more common in a younger population.
Wow. So some really serious consequences for concussions. Talk a little about some of the signs and the symptoms, because I know parents have got to be very concerned, especially those that have kids that play football. But now that we've kind of established that this is a much bigger population than just the football players, it's something for all parents to be watching.
True, it is, yeah. And one thing I think that's important to understand about concussions is it doesn't necessarily require a blow to the head. A lot of people think that you have to be hit in the head in order to have a concussion, but there are other types of collisions that can occur that could cause your head to get jarred or bounce around and still cause a concussion.
So what are some of those examples of those kind of things?
It could be two athletes, let's say if they're playing soccer and they simply run into each other but don't necessarily hit heads. Or if someone falls to the ground but not necessarily hitting their head on the ground. Still, those kinds of situations might result in a concussion if the head is getting knocked back and forth or being rotated in some way. Your brain inside of your skull kind of bounces around in there, and that can cause some swelling and some other symptoms like headache, dizziness, nausea, maybe sensitivity to light or noise. Sometimes the athlete might be briefly confused about what's going on or where they are. Those are things that can happen even without a blow to the head. Another common misconception is that a concussion only occurs if there's a loss of consciousness. There are actually many cases, most cases I would say, of kids who have concussions do not lose consciousness, but they still have a concussion. And losing consciousness does not necessarily mean that the concussion was more severe.
Interesting. So a lot of people think you get knocked down, you know, a lot of sports, okay, we're going to be tough, we're going to get back up. Why is that the wrong attitude to take when it comes to concussion?
Well, you're right. That is a common attitude that a lot of athletes have, and I think part of the reason for that is that with most types of injuries, there is this model of kind of pushing through it. You know, if you have a sprained ankle, if you're just in a little bit of pain, you just tough it out and kind of push through it. In concussion, though, you're dealing with what is essentially a brain injury, and trying to push through a brain injury usually backfires. If you continue to do all of your regular activities, whether it's physical activity or strenuous mental activity, this can actually make your symptoms worse and make it take a lot longer for you to fully recover. So you can't tough out or push through a concussion. That is really not the right mentality for this type of injury.
So it's not only important for parents to understand what signs and symptoms, and I want to go over those again because I know we kind of went through that really quickly, but signs and symptoms, but it's also important for coaches to really know and watch the players even when the parents aren't there, to understand what's going on. But let's first cover, before we go on to coaches, let's get those signs and symptoms. So what are the things, your kid starts displaying some things, you know there was something that happened, maybe it wasn't a head injury or direct head contact like we were talking about. What should parents be on the lookout?
Well, the most common symptom by far is probably headache. Not everybody experiences a headache, but a lot of people will experience a headache after a concussion. Dizziness, nausea, sometimes vomiting. Like I said, there may or may not be a loss of consciousness. Some people may be confused. They may not remember recent events like what they were just doing or the play where they were injured. They may have trouble remembering things after the injury. They may have sensitivity to light or noise, really bothers them. So there's a number of symptoms, and not all people who have had a concussion will display all of those. So you have to be very careful about questioning and examining someone on the sideline to really determine if someone's okay. A lot of times the athlete might say they feel fine, but if you ask them some more questions specifically about some of those symptoms or challenge them in a way, ask them what's the, what quarter is it right now? What's the score of the game? Or who scored last? See if they can answer questions like that, and if they can't, then that might suggest that there's a problem.
Yeah, and signs and symptoms are so very important for the coaches and the parents. We're going to give you some resources at the end of the chat where you can go to a website and take a look at some of those as a reference. So we can do that a little bit later, so if you didn't get all those down, no worries on that. Talk about the role of coaches. A lot of times in high school sports, football teams have quite an array of coaches. There's a lot of coaches, there's a lot of resources. Of course, there's a lot of kids playing too. Different kinds of sports rehab folks, all different kinds of things. In other sports where kids are playing that concussions are possible, they don't always get all of those resources. It may be the English teacher also serves as the cheerleading coach or something like that. So what is it important for any coach of a sport to really understand about concussions and how to treat those if they see something unusual with a child?
Well, we are sort of fortunate in a way in Central Florida. Many of the high school athletic programs here have not just a coach but also an athletic trainer. But that is not true in all high schools. Not all high schools in Florida have an athletic trainer. So whether it's an athletic trainer or a coach, and as you pointed out, regardless of the sport, I think it's important for those people to be aware of what the signs and symptoms of concussions are, and that a concussion can occur in some of these other sports that we maybe less commonly think about when we think about concussion. I had mentioned some before, cheerleading. We've seen a lot of lacrosse players, soccer, even things like horseback riding, so there's a lot of different ways that an injury can occur. I think it's important for any coach or athletic trainer who's involved in covering those types of athletics to also be aware of what some of these symptoms are.
Very important. And we would certainly welcome your questions if you have them for Dr. Legalbo to talk about sports concussions. We can continue to kind of talk, but we'd love for you to submit your thoughts or a question that you may have here, right here on this forum during this live chat. Talk a little bit about the treatment for concussion. So let's say we've recognized that an athlete has a sign or a symptom of concussion, and we want to look for treatment. What is the best way to go about that?
Well, this is kind of tricky. There's some people in the healthcare community that are more familiar perhaps with treating and managing concussions than others. One of the things that we try to do in our program, even before someone has a concussion, is try to make sure that they have what we call a baseline test. So we do a computerized test that evaluates things like memory and reaction time at the beginning of the season for a lot of the athletes that we cover, so that we know if they have an injury at some point, we can give them the test again and see if there's been a change, see if there's been a decline in their cognitive performance. If there has, that suggests that this concussion is affecting them in some way, in some aspect of their abilities, either mentally, cognitively, memory, concentration, that kind of stuff. And that might also have a negative impact on their academic performance. So what we do is to try to recommend basically some guidelines to try to avoid activities that might exacerbate their symptoms. And the two main activities that can make someone's symptoms worse if they're trying to recover are physical activity and mental activity. So we encourage people, if they've had a concussion, not to engage in any physically strenuous activity, no aerobic exercise, lifting weights, nothing that would increase their heart rate or put any stress on their body. We also encourage athletes not to engage in strenuous mental activity for long periods of time. So sitting in class sometimes can make someone's headache worse if they're sitting in class all day. Studying at home, reading, doing assignments, we often make recommendations for academic accommodations to try to help those athletes and lighten their load in terms of their schoolwork to help them recover faster. But there's currently no medication or type of intervention or treatment that we have that will help someone recover faster. It's really more a matter of patience and taking time to let your brain heal.
Well, and one of the important steps is that baseline test that you talked about. So then if you have the baseline test, you know where you have to get to. If you haven't had that test, then I'm sure that makes your job a little bit more challenging.
It is more challenging, but it's not impossible. We see those kinds of cases all the time as well. The baseline is very beneficial because, yes, as you said, it gives us something to compare so that if we repeat testing a kid a couple of times when they're now saying, I'm not having any symptoms, my headache has gone away, I feel 100% better, we can test them again, and if in fact their scores look just as good as they did at their baseline, then we feel pretty confident that they have fully recovered. In cases where we don't have a baseline, we have to do a little bit more guesswork. We have to use a little bit more judgment in interpreting what those test scores might look like or where we think somebody might have been prior to their injury. And sometimes looking back at someone's academic performance, how well they do in school, sometimes that can help to give us some idea, but even then it's a little bit trickier.
Yeah. Let's take a question. We have one that's coming in on the web. What is the correlation of multiple concussions for suicidal tendencies? So I know there's been a lot of controversy about this, especially in the professional world, especially football.
Yes.
Talk a little bit about multiple concussions and then potential for suicide.
Well, I think that this is something that has been apparent in the media a lot recently, as you mentioned, because of some incidents that have happened with some NFL athletes in particular. From my standpoint, I certainly have seen plenty of athletes that have had multiple concussions. They appear to have recovered fully from each of those, and I really don't have any reason to suspect that it's going to have any long-term consequence for them. Unfortunately, though, there are cases of people who have had a concussion, and then kind of like I was saying before, if that concussion was not managed properly or if they did not fully recover from that, and they had another concussion while they were still symptomatic, and then maybe another one on top of that, those are the kinds of cases that are more concerning for me in terms of having a cumulative effect of multiple injuries back to back. The correlation with suicide is a little bit more of a question mark in my mind, because even if you look at people who have had multiple concussions, there are far more people who've had multiple concussions that have not committed suicide than who have.
Right.
And the people that have committed suicide, as I said, they get a lot of media attention, but finding that correlation, I think, has been a little bit tricky to make that a direct cause-effect relationship.
Good question. Thank you so much for bringing that up. And certainly, one other thing, it sparked another question for me. You know, if you don't get that first concussion, if you don't recover completely, is it easier to get a second or third concussion if you're not managing that and not treating it? Is it easier to get hurt again?
Yes, yes, it definitely is. The way I think about it is your brain is in a more vulnerable state while it's trying to recover. And so another injury is more likely to happen, perhaps even with a lighter blow to the head. It's also likely that the symptoms will last longer, and it may take longer for someone to recover, and they may experience more severe symptoms with that second collision.
One important question that I'm just looking at here on the web, how will this new law affect my son playing football? We haven't gotten to the new law yet, but it sounds like perfect time that we should. There's a new concussion law in effect. Tell me a little bit about the law, and again, then we can answer our question here. How is it going to impact kids playing football or playing any sport for that matter here?
True, yeah. It's not just referring to football, it's referring to all high school athletics. And perhaps even beyond high school athletics. There's a couple of things that the law is trying to do. One is it's trying to improve education about concussions. And part of the law stipulates that, as we were talking about before, coaches and appropriate people who are dealing with these athletes are aware of what a concussion is and what the symptoms are and what to look for. Another part of the law specifies, I guess a little bit more specifically, what types of procedures have to happen after someone is suspected of having a concussion before they're allowed to return back. So it's really to try to improve athletes' safety is the intention of the law. The way that the law is worded is kind of a little bit of a question for me. There are some concerns that I have about it and how it might have actually maybe not that great of an impact on some athletes in terms of their return to play. But the main part of the law is to try to help improve patient safety. Basically, what it's going to mean for a football player or anybody else playing sports is that if they're suspected of having a concussion, they'll be removed from play, typically by the coach or the athletic trainer, whoever it is that's at the game. Some sort of evaluation then has to occur by a medical professional who's considered to be an expert or trained somehow in the management of sports-related concussions. And before that athlete can go back to play or participate in any type of conditioning or even a practice, they have to be cleared by a physician. So they will have to see a physician at some point to be cleared in order to go back to play.
And your thoughts on that as a basic thing? I mean, on the law, is it a good idea to kind of give people, give coaches, give parents some parameters on how to treat this? Is that helpful, do you think?
Yeah, again, I think the intention of the law in general is good. The educational component, I think, was definitely needed, and even highlighting that some sort of guidelines are set forth in order for someone to be cleared to return to play. A lot of states are doing the same thing. The way that Florida's law is worded and how it's been constructed is, in my opinion, different than how many other states put their law together.
Right.
And they more specifically describe what type of providers can or cannot clear an athlete to return to play.
So let's talk about that a little bit, because I know the law here in Florida does not, it just says an MD. And I know there are some concerns about that amongst the concussion community, that maybe not every family practice physician might have the skills that a specialized concussion program would have in evaluating students. So if parents are looking for the best option for their son or daughter, whatever the sport may be, what would your recommendation be?
Well, most healthcare professionals who manage concussions across the nation and really across the world consider one of the most important aspects of concussion management and determining when someone's ready to return to play. It's considered to be the neuropsychological testing that I had mentioned before, which we use on a computerized version. That data gives you some objective information about how someone's brain is functioning. And the reason why that's important, I think, is that a lot of times these athletes will have different motivations about returning to play. And they may tell you that they're not having a headache, even though they might actually have a headache. Taking a test, the test is not going to lie. If someone's having trouble in terms of their memory or their reaction time, that's going to show up on the test. There's no way you can get around that.
Yeah.
So it gives us more objective information about whether someone is really still having problems related to the concussion or not. And a neuropsychologist is the best educated, the most equipped type of person to read and interpret those types of tests and then make a determination as to whether someone is ready to return to play or not. The law in Florida does state that a neuropsychologist basically is excluded from that population of individuals, healthcare providers, who can provide that written clearance to return to play, which in my opinion is a downside of the way the law is written. However, in our program we've taken steps to adjust and adapt to that change, and so that we can meet the criteria of the law but still provide the standard of care to the athletes that we see.
Yeah, a couple more questions coming in from the audience that I want to look at. One of them is, how much does it cost to go to a specialized program like the one that Florida Hospital has? Is that more expensive than going, and maybe is that covered by insurance?
It is covered by insurance. We do take most healthcare insurance plans. Typically, you would just be paying your copay, whatever that would normally be for seeing a specialist. There are other options for payment for people who do not have insurance as well. We even will do baseline testing. We had mentioned before, if your school does not do baseline testing, we can do that as well. But it's not, we're trying to make it as user-friendly as we can.
Sure.
And reduce the cost and the impact on the student, the athlete, and the family, while still providing what we believe is the best possible care that we can.
Yeah, yeah. Really important to get that specialized care. And I think we've kind of covered most of the different questions that we've got here on the web. Kind of going back to concussions, now that this law is going to effect, do you think this is going to impact the number of concussion diagnoses that we're going to see when it comes to younger people in high school, these high school students? Or is it, again, just more people coming out of the woodwork that we didn't know about before?
That's a great question, and honestly, I don't know the answer to that, because I think there's a couple of ways it could go. Certainly over the past few years, we've seen an increase in the number of reported concussions. I don't think that that's because more of them are happening. I think it's because we're catching them more than we used to. My concern, though, is that, again, with the way that this law, the certain steps that this law requires, even though I think it is, again, in the athlete's best interest and to try to promote safety, if athletes start to feel like this is a barrier to return to play, and it's delaying their return to play, and now they're missing games, I'm concerned that we may actually see a decrease in the number of concussions reported, because they know if they say something, they'll be removed, and they might not be back in the next game
Yeah.
or the one after that.
But this is where parents need to be extremely vigilant on if you suspect your child has had some kind of injury, to really watch for the signs and symptoms, because you probably know your kid best.
Right, and their health comes first.
Yeah, absolutely. We talked very briefly, and I just want to kind of put this out there as we kind of wrap things up here. How can parents find out what the options are for their kids at school? We talked about some schools do offer the baseline testing as part of an athletic program. How can parents find out more about that, or encourage their school to take part in something like that?
Well, usually the athletic trainers at the school or the athletic director would know whether they have this type of baseline testing available. At some schools, I've noticed it's given to the higher profile sports. It's more likely to be given to football players than cheerleaders, for example. But really, everybody who's participating in any kind of sport, particularly that are at risk of contact, I think should have a baseline. If you find out that your school does not offer that as an option, or if your kid participates in club sports where they may not have that available, you can either try to encourage your school to obtain it. It's really not that costly in compared to what some equipment for some of these sports costs. We also, as I mentioned before, our concussion program does offer baseline testing for athletes who are participating in sports and who may not have any place else to go to get it done. And then we'll have that information on hand if, unfortunately, somebody does have a concussion at some point. We can make that comparison.
Yeah. Dr. Legalbo, thank you so much for all of your time today and answering some of my questions and some of our audience's questions about sports concussions. We got to wrap up our time here for our Healthy 100 expert chat, and of course thanking Dr. Legalbo for his time, and thank you so much for taking part in that as well. And I promised a website. There's a lot of things, may have unanswered questions or are looking for a resource to learn more. You can go to www.fhsportsmed.com/concussion. That is up there on your screen, where you can learn more information about the Florida Hospital Sports Concussion Program that's here. Of course, there's also, we talked about signs and symptoms of concussion. You can find that out on the website. There's some facts about concussions as well, so some really great resources for parents. If you'd like to do more than that and just learn on the web, if you'd like to make a phone call to speak with someone in the Florida Hospital Sports Concussion Program, you can do that by calling 407-303-8012. Again, that's 407-303-8012. Can you reach them directly? Thank you so much for participating in our chat, and we certainly get a lot more out of these type of things when we get questions from the audience, so we love to do that. You can find out more about upcoming web chats by linking to Florida Hospital on Facebook. Just like us on Facebook, you'll get our regular updates. That's where we post all the information about who's the next health expert and when that's going to be taking place, and we'll give you several updates again on when that next topic is going to come up. Thank you so much, and we enjoyed talking with you about sports concussions over the lunch hour. Have a great afternoon.